5 things nobody tells you about menopause symptoms. Being a woman is hard. Transitioning from childhood to puberty is an awkward experience. Menstrual cycle dictates and in a way dominates our decisions. The mood swings, the cramps, the blood-stained undergarments are a regular feature in a young woman's life. Each month an egg is released from the ovaries. Reproductive hormones such as progesterone cause uterine lining to thicken and fill with blood. If the egg is fertilized, the uterus is ready to receive it. If not, then the endometrium begins to shed and the regularly scheduled crimson tide arrives. All human females are born with a finite number of eggs, an egg account, in a manner of speaking. When the reserves deplete, well, that's what we call menopause. As you get older, your reproductive cycle slows down and then eventually stops. As menopause approaches, your ovaries produce less and less estrogen. When this happens, your menstrual cycle begins to change. It may become erratic and then eventually stop. This marks the end of the reproductive years. The symptoms of menopause and perimenopause can have a significant impact on our life. It can impact relationships, social life, and work. Symptoms typically appear months or in some cases even years before your periods stop. This is known as perimenopause. Menopause is diagnosed after 12 months of not having a menstrual period and typically occurs in your 40s or 50s. Everyone will experience it differently. You could have several symptoms like hair thinning and weight gain, or none at all. Some may feel relief and feel liberated, while some may feel a sense of loss. It depends on each individual. There are numerous symptoms of menopause, so let's look at some of the symptoms briefly. Irregular periods. This may be the first thing you notice. Your periods may stop being regular. Period skipping is common and expected during perimenopause. Menstrual cycles frequently skip a month or more and then resume. The periods can be shorter or longer in duration. It is also possible that you will bleed more, or on the flip side, bleed less than your usual period. Period cycles also tend to become shorter, bringing them closer together. All of these are normal changes, but to ensure there isn't a problem, you should discuss these changes with your gynecologist. Emotional roller coaster. Around the time of menopause, you may experience mood swings or irritability. The exact cause is unknown, however, reduced levels of estrogen is believed to be linked to anxiety and in some cases depression. Add to that mix the mounting stress of family changes such as growing children or elderly parents or a history of depression could all be contributing factors. Discuss your concerns with your physician or mental health professional. There are treatments that can help. If you're feeling irritable and depressed, it could be related to menopause. However, many things can make you feel irritable. Although menopause does not cause depression, studies show that approximately 20% of women experience symptoms of depression during this time. If you've had depression before, then unfortunately, you're more likely to get it again. Consult your doctor if you're finding it difficult to cope. They may be able to recommend medications or therapy to help you get through this difficult period. Here are some suggestions to help you deal with your fluctuating emotions. Exercise regularly and eat a healthy, nutritious diet. Some women find it helpful to adopt a skill to help them relax, such as yoga, meditation, or rhythmic breathing. We suggest you avoid sedatives and alcohol, as these have been shown to complicate symptoms further. Participate in a creative outlet that gives you a sense of accomplishment. Maintain contact with your family, friends, and community. Vaginal discomfort. Burning, dryness, itching, and vaginal soreness are all symptoms of vaginal discomfort during menopause. You may experience one or more of these symptoms. The sensation of tingling and burning in your genital area can be difficult to ignore. It's usually the sign of other vaginal problems that can occur during menopause, such as urinary tract infections or vaginal irritation. Itching can be extremely uncomfortable and even painful at times. Itching is caused by low estrogen levels that can cause a thinning and drying of the vaginal walls. Dryness of the vagina can also occur as a result of menopausal hormonal changes that affect the pH levels, and therefore the moisture level in your vagina. An unfortunate side effect of this is discomfort during sex. Many women feel less aroused, which has an impact on their personal lives. Sleep disorders. Women at this stage can also develop sleep disorders, such as sleep apnea, which can be caused by lower levels of estrogen and progesterone. Women frequently feel fatigued as the day progresses. This is a side effect of not getting a good night's sleep. Exercise on a regular basis can help menopausal women have a sound sleep. Sleep deprivation can make you feel irritable or depressed. It can cause one to be more forgetful than usual and lead to more falls or even accidents. Hot flashes, particularly night sweats, and mood changes like depression can all contribute to a poor night's sleep. Many women experience a sudden warmth in the face, neck, and chest. This can be accompanied by sweating and chills. Managing these issues may also help in management of sleep symptoms. Over-the-counter sleep aids, such as melatonin, may be used by some women who have difficulty sleeping. Others use prescription medications to help them sleep, which can be beneficial when used for a short period of time. However, dependency on medication is not a cure for sleep disorders and should not be used long-term. To improve your sleep during and after menopause, we recommend you maintain a regular sleep schedule. Every day, go to bed and get up at the same time, and avoid napping in the late afternoon or evening, as it may keep you awake at night. And remember, alcohol and caffeine will disrupt your sleep. Even minor amounts make it difficult to sleep, so we suggest avoiding them. Instead, make a bedtime routine. Some people relax by reading a book, listening to soothing music, or soaking in a warm bath. It all depends on what's helpful to you. Try not to watch television or use any device at least 1 hour before bedtime. In fact, avoid using them in your bedroom altogether. Exercise at regular times throughout the day, but not too close to bedtime. Also, avoid eating large meals at night. Weight gain. Menopause's hormone changes may cause you to gain weight around your abdomen rather than your hips and thighs. However, hormonal changes alone do not always result in weight gain. Weight gain is usually caused by aging as well as lifestyle and genetic factors. Muscle mass typically declines with age and fat increases. Loss of muscle mass slows your metabolism. This can make maintaining a healthy weight more difficult. If you continue to eat the same way you always have and do not increase your physical activity, you will most likely gain weight. Menopause weight gain may be influenced by genetic factors. If your parents or other close relatives are overweight, your chances of being overweight increase automatically. Along with the 5 major symptoms, some women may experience body aches, headaches, and heart palpitations. Keep in mind that menopause is a normal part of every woman's life, and it's completely natural. The physical and emotional symptoms of menopause can be taxing and in some cases traumatic. Hang in there. It is important to remember that menopause marks the beginning of a new era in a woman's life, where she no longer has to worry about PMS, body cramps, and getting pregnant. So embrace this newfound freedom and try to accept your body and enjoy yourself. If you enjoyed our video, give us a like and keep watching your screen for more content.